and let us discuss some remedies and some differentiation which were asked, I think 3-4 days before on my WhatsApp, and I think the doctor is still not online, so I'll not start that discussion. It has been now 2.5 years. I'm taking my YouTube live, and we have never been absent on Saturday except one day we took on Monday. So I hope you understanding what basically I wanted to convey you in the clinical practice which I have been doing. Yeah, so welcome Dr. Sharon. A new case which came to me, and we took a very, very important, very, very important rubric for that case. Yeah, welcome Dr. Smith. Now we had a very interesting case. Hello Dr. Anja. We had a very interesting case, and the whole case was taken, and the patient appeared that as if that he was meant for the society, used to help in the society, used to do something for society out of his pocket also, sometimes taking his own toll on his pocket, own toll on his life, but he used to help the society. And he suffered from that typical bony pain, joint pains and all. Very interesting rubric we took. We basically prescribed the patient strontium carb. If you go and see strontium carb, of course, it has a lot of symptoms of in relation to bones, in relation to extremities. But I have told you some symptoms of strontium carb, which are very, very important. The first symptom which I told you, I will not waste time into asking you. I told you strontium carb better in sun. The patient is much better in the sun. And the second symptom, the rubric which we took for prescription was responsibilities, strong, social. A strontium carb has a very, very strong social responsibility. And that makes the whole strontium carb patient, That is in relation to mind. If you see strontium carb symptom in relation to joints also, it is a very, very important remedy for especially there is chronic spasms or especially in relation to ankle joints. And there is lot of cramps in the soles and the calves, lot of cramp. And you must have never used strontium carb whenever there is lot of cramps in the soles and calf muscles. Do use strontium carb. It gives very, very good results. One more symptom in relation to strontium carb arthritis symptom is rheumatism with diarrhea. So whenever you come across complaints where the patient has rheumatism with diarrhea, do think about strontium carb. Of course, I prescribed strontium carb because of that responsibly strong and spasms of the ankle joint. And one symptom more important of strontium carb is the feet are icy cold. The icy coldness of feet again is a very, very important symptom of strontium carb. Because whenever icy coldness comes, of the feet, we have a lot of other remedies. And if anybody could tell me some of the remedies where the feet are icy cold. Anybody? Icy coldness of feet. We never think of strontium carb. Anybody? Icy coldness of feet. Whenever you have these symptoms, there are so many remedies, But strontium carb, Calcarea silicata. If you have icy coldness of the feet, think about few remedies which are very, very. One is Calcarea silicata. I have frankly speaking, I have never read symptom of icy coldness of feet, of foot, you can say. But I have found 3-4 remedies which are very, very important when there's icy coldness of the foot. Do think about remedies, 3-4 remedies: elapse, phosphorus, viratramal, silicia, sepia, and one camphor. I have found these useful, very Calcarea and silica. Yeah, it is there. Calcarea and silicia is definitely there. So these 5-6 remedies are very, very important, but strontium carb is also there. So whenever if you are studying a remedy, make sure that you study the remedy in the whole extent so that you are not only a specific symptom of a particular remedy, like strontium carb, only symptoms of the extremities, rest you forget. If you study strontium carb, of course, I prescribe, frankly speaking, strontium carb on the symptoms of responsibility strong, which is very social. But this icy coldness of feet I have found in many of cases of strontium carb, and it's a very, very important remedy, strontium carb. Of course, strontium carb is a very, very important remedy for arteriosclerosis also, and that's why a very important remedy for high blood pressure with flushing of the face and the pulsation of the arteries. It's a very, very important remedy. That is for high blood pressure. And in strontium carb, remember one symptom, very, very important in relation to bones is that especially femur bone is affected. Femur bone. And after post-COVID, you might have got a lot of cases of avascular necrosis of femur. Do think about strontium carb in these type of complaints, whether femur is involved. So this is in relation to strontium carb. I was just telling you the mathematics of strontium carb, though I prescribed or entered the case, the primary rubric was responsibilities, social, very strong. So this is something about strontium carb. Let me welcome Dr. Akshar Parmar, Dr. Prasant, Dr. Alexander Yash is there. Cilicia and Calcara are definitely there. So as we move forward, if you don't have any questions, we can always, inherited asthma in 40 years male, he is very chilly and his key symptom is get sudden suffocation. It may be at time, please help. See, whenever you have case of hereditary asthma, make sure that your case taking has few symptoms which are very common to the father and mother, and one symptom or two symptoms which are very, very unique to the patient, so that you are able to individualize that patient. Very important. Now, hereditary of the history asthma, and you have used the word sudden. Now, see, whenever you are using the word sudden, make sure that don't get it. Make sure that it is either restricted only to asthma, or it is restricted. It is a generalized symptom. If it is basically restricted only to asthma, then you have very small group of remedies and chilly remedies. Now, you want remedies which have sudden asthma, hereditary asthma, and the remedy should be chilly. So, whatever mathematics I have, I can give you few remedies which are chilly. The attack is sudden, and it is hereditary asthma. Do think about three remedies. First is ignitia, second is graphitis, and third is cuprum metallicum. Though iodine is also a very, very important remedy for asthma, especially hereditary asthma. But in your case, you have written classically hot chilly remedies, and iodine is hot. So I have not taken that remedy. But if you generalize your case, and you say sudden manifestations, so make sure if it is a generalized symptom, sudden manifestation in whether it is asthma or it is joint pain, it is migraine, it is. So suddenness also, that is important. If you have suddenness of symptom, do think about belladonna, tarantula, magnum aceticum, and aconite napellus. So these are two things which you have to understand, Dr. Indranil, and then go for prescription. Chronic sinusitis and tonsils, PND, violent headache, pain in eyes after exposed to cold air or during an winter season, frequent stomatitis, anal fissure, tubercular heritage, always fever. Now, see, whenever you have, it's a very, very interesting case, chronic sinusitis, and see, when basically most of the cases, if you see in sinusitis or any cases where related to cough, cold, coryza, most of them have aggravated in the winter. So if you are taking that, it's okay. If you have, I'll give you the remedies also. Your patient is hot or chilly, frequent stomatitis, always fever, exposed to cold. Okay, so aggravation winter, and the patient has stomatitis and all. Whenever if you get these type of symptoms, there are few remedies which are very, very important. You can write down in your mathematica, and for this case also. Now, of course, there are few remedies which are very, very common, and if you have written, you have continuous fever, recurrent fevers. 3-4 remedies which will be indicated in these complaints. First would be arsenic album, very, very important. Second should be rust toxicodendron. Third should be Hiparsulf, and fourth should be Calicarb. Arsenic is chilly, Calicarb is chilly, Hiparsulf is chilly, rust tox is chilly. With all the symptom of suddenness, with all the symptoms of frequent stomatitis, with anal fissure, and always having fissure. This is one part. But I would like to add some 3-4 remedies which are very, very important in your case also, which have aggravated in winter, and these remedies, maybe they are hot, that's why I didn't tell you in the first instance. You have to also remember fluoric acid. Very, very important. That covers that recurrent cough and cold, that covers the fever, that covers stomatitis, and that covers anal fissure also. Second, you must always remember pulsatilla. That also covers everything, and if you have read pulsatilla from Clark Mathematica, it is written, it's a very, very important remedy for varicose vein and vascular engorgement. And piles is also vascular engorgement and followed by fissure. So you have to think about pulsatilla also. Third remedy you should think about is Nux vomica, and the fourth remedy you should think about is lycopodium also. So these 8 remedies fits in your case very well, and one of these remedies should fit in your case. Of course, there are some rare remedies also that you should think about is natrum ars. Do think about natramal. That's also a very, very important remedy, but though rarely indicated. And do think about sickle core also. Best videos 3078. I don't have your name, so I cannot tell you by name. So we have solved the 2 questions. I hope. Sent a request to be in your live video. Dr. Shweta joined. Welcome. So we have, I hope you understood this. Calf becomes very hard and painful after walking in 39 years male patient. Yeah, see, we have remedies where the calf is so hard. It is written in a mathematics, it is like stone. Now in homeopathy, what happens? Every symptom you tell, you have to be so specific because every symptom has a different remedy, and that's why when you tell that the calves are very what you call calves becomes hard and calf becomes this type and walking, there may be a lot of remedies. But I'll just tell you, when the calves become very stiff, द पेशेंट को लगता है कि भैया मेरे को बहुत ऐसे लगता है कि मेरे काफ पूरे पत्थर के समान बहुत कड़क हो गए. Few remedies that you should think about, and the first remedy that you should think about is of course Cuprum metallicum. It has classical symptoms, when the calves are basically very hard. As you go further, I'll first tell only the simple remedies, then that you will be able to prescribe properly. The second remedy that you should think about in these type of complaints is simple remedy McPhos. McPhos, though sometimes we only think of McPhos as pain in the abdomen or just remedy for what you call dysmenorrhea, where there's a lot of pain during menses and McPhos is the work is over. No. McPhos also is a very, very important remedy in these type of complaints because McPhos also covers this type of complaints also. Now, sometimes the tendons, the calf are so hard, it becomes like a stone. It is very, very hard. In that type of complaint, you must remember Bovista causticum. There are a lot of remedies, but I'm just telling you a few remedies which are very, very important. Next, there are a lot of cramps. After the cramps, the calf becomes very hard. You must think about Naxomica, do think of Plumbum metallicum, and do think about sulfur. Again, sulfur never thought of, but very, very important remedy in these type of complaints. So I think I've given you 5-6 remedies. These are the remedies they should think about. Don't ignore the cute remedies or the remedies which have a very specific notion that this is remedy for this. No. Study the Mathematica in detail so that automatically you will get more wide application of symptom. I had a case come across a case where the patient used to complain of lot of heaviness of calf muscles. He used to say, I feel very tired because my calves are so heavy, I have to sit down. It was a very, very interesting case, calves feeling very heavy, and that's why the patient is tired and that's why he has to sit down. Which remedy worked? Anybody? It was a very, very interesting remedy which I prescribed. The calves feel heavy and the patient feels tired, the legs feel tired, so has to sit down. Anybody, can you guess the remedy which I prescribed to that patient? Welcome, Dr. Krutika. Anybody? Rustox. Okay, Rustox is there. Definitely it is there. There's no doubt about it. But Rustox is more important when the calf, there is a lot of cramps, Letharis. No, Letharis, no, not Letharis. See, we are not talking about the paralytic condition, the motor paralysis and all. We're just telling you that it's a functional symptom, that the calves are so heavy, the calves feel so heavy that they are tired. You will be surprised. That's why I always Argentum metallicum. Yes, Dr. Gotika. Yeah, it is Argentum, basically Argentum nitricum, not metallicum. And you'll be surprised, I prescribe the patient Allosocretina. And if you see Allosocretina, as I always tell you that whenever you are learning a remedy, don't only learn the specific part. Everybody knows in Allosocretina it is a fantastic remedy for the diarrhea, mucus stools and all. But I prescribed that patient Allosocretina, which worked very well, and the patient felt much better with that. That's how you have to study a remedy. In Allosocretina, what it is written, Normally, we never prescribe patients that is pain in the soles while walking. We normally prescribe Ruta or Belisper or Calcarea Flor or Ledampal. But if you read Allosocratina, it is written Allosocratina has pain in the soles when walking, and the calves feel very heavy and as if tired. So I prescribed him Allosocratina, which gave wonderful results. Of course, we added some symptoms of other symptoms also, but Allosocratina was given. Can you imagine Allosocratina for pain in the calves? That's how you have to develop your mater medica. Whatever polycrest remedy we have, it has been proved at length. That's why the symptoms, if you study it deeply, you'll automatically come to know that you have been missing so many remedies in your practice because you have been told some specific about that condition which you cannot come out of it. And that's why you fail to prescribe these remedies. I hope you go and read Allosocratina, you'll get a good idea about that remedy. So this is in relation to scalp, which I just got in my head. That's why there may be other things also in the scalp, in the calf, but these are the remedies which I have been using in my practice with good results. Only one thing which I remember, there was one the patient who told that, हिंदी I'll tell you, that ऐसे मुझे लगता है कि मेरा काफ पूरा सुन्न हो गया है, मतलब ऐसे लगता है सिर्फ ठोको मारो तो कुछ लगता ही नहीं वहां पे है. Which remedy is that? The patient feels as if the calf is numb. The calf is numb. So which remedy comes to your mind? Numbness of the calf muscles. Which remedy comes to your mind? Anybody? These are very, very interesting facts about a mater medica that everybody should remember, because, okay, we have a question, so you answer at your own time. Which mind symptom would you choose when a girl feels that she is ugly one in the family, including family mother, okay, and all the friends and cousins were saying, are you sure she is your daughter? Yeah, so such a very, very interesting symptom, and we face this problem too much I also face this problem, lot of patient complaints, but then you have to first understand actually she is ugly or she feels that she is ugly. That means the patient is very, very sensitive. I would just take one symptom, sensitive. The patient is sensitive to her looks, the patient is sensitive, and that's why the patient has what you call consciousness about the health, consciousness about the beauty, conscious about the self. And that's why I would only take a symptom sensitiveness and then proceed with the case. Here was their love was broken. Here was where the love was broken. Okay. So I would basically go with the sensitiveness rather than exactly having that inferiority complex or consciousness about the looks, rather than just go with the generalized symptom of sensitiveness, and you will get into the case. If I would have this type of case, I would add one thing, which type of sensitiveness? Painful sensitiveness of the mind, painfully sensitive. The patient is painfully, it is paining her, painfully sensitive in the mind, and these type of personalities are so sensitive. That's why there is a lot of excitement in those. That's why they are sensitive, and that's why if you see the painful sensitiveness of mind, the remedies are very, very simple: Coffea cruda, Nux vomica, sanguinaria, spigelia. Yes, she cried when a symptom. Painfully sensitive. That is, there's a lot of anguish in the patient mind. So painfully sensitive, and the remedies are also that sensitive remedies. Coffea is there, Nux is there, sanguinaria is there, Cilicia is there, spigelia is also there. Oh, she's 57. She's 57. So very, 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 very surprising. That means that sensitiveness has been since years, and now it has been localized, a syphilitic symptom in relation to the body. So you have to ask what was the trauma of the sensitiveness of the whole life process, and then understand the case rather than taking only for the consciousness of the health. So we have a lot of answers. Has chronic kidney disease? I need to get the Okay. So I think Dr. Alexander, you could write some more life events where the sensitiveness was very well marked, so that we can work out rather than just one or two symptom and the remedy. Because in those cases, syphilitic symptom has to be important. The sensitive there's one more rubric in mind, that the sensitiveness is penetrating. The sensitiveness is penetrating. I'll give you a syphilitic sensitiveness. Sensitiveness is penetrating, and if the sensitiveness, okay, we have always seen that the voice penetrates in the teeth and the remedies 3D on, but it's painfully sensitive, penetrating sensitiveness. Lycopodium, iodium, ferrum metallicum, conium, china, these are the remedies. So we have the whole case maybe of the life events where the patient had that sensitiveness exposed, and then we can go with the remedy. So we have some remedies for cough. Cuprum metallicum, sickle core, veratrum viridi. Now I'll tell you one thing. If you have attended my materia medica classes, I had told one remedy that the patient has so much pain in the face. The pain is so much, the face becomes numb because of the pain. That is the same. I told you, what is true to the part is true to the whole. And the same numbness of the face because of pain, and the same numbness of the part because of pain in cough. Both the remedies are same. Yeah, platina. Fantastic answer. I think you must have attended my materia medica class. That is what I tell you, everybody. Boning-Goshen concept. If there is numbness, there's so much pain, the pain becomes numb. The same happens in the calf, and that's why numbness of the calf, that's also platina. Just that was a case which just went through my mind. Platina is there. Hereditary CKD with shrunk kidney with miasm. See, miasm this is syphilitic, and you'll be surprised. I have a case of a family where all the three brothers have CKD problem. All the three brothers, creatine high, and all of them are much better with my medicines. But so surprising, and they are married, they have children also. But let us see, how does the children have the disease, syphilitic part. But their father also had it. All the sons have it. They have children which are very young. They have not tested it, but I'll be waiting to see whether that helps or not. The miasm is out and out syphilitic. The hereditary history is there, and syphilitic miasm is there. Go and ask the syphilitic symptom in CKD. Though all the three are better, but let me tell you very frankly, Dr. Indranil, I also have a lot of cases which do not respond as I expect in CKD cases. Some have good results, some do not have good results also. But I also find it difficult in treating CKD cases. But these three brothers are absolutely fine. Sorry, they are doing very well with the medicines. The creatine was, I think, 4 to 6 in between. Now it is 2.1. It is there. Sometime 1.8 also it comes. I have taken a syphilitic rubric. Dr. Asha, Dr. Mayank, welcome. Dr. Kiranji. Phimosis, children 6 years, best medicine. See, phimosis, children's best medicine, I would first tell that the patient is not taking the prepuce back and front totally. There's no habit. Second, there is an infection. There is an infection, that's why the prepuce cannot go behind. Simple, it either infection or inflammatory conditions of the prepuce. Give that patient single dose of belladonna, LM potency or 1M potency or 200 potency precipitation, and tell the patient to do dressing with calendula, mother tincture or external use, and I think the pain will resolve and the patient will be much better. Lots of cases have given me with these remedies good results. Now, basically, if a case of phimosis comes and there's a problem of retraction, my assistants also give the remedy and they are better. So I don't look at these cases. But this is the protocol. You try that and I think you will get some relief with the patient. And if you see that the patient is better, do share your experience on the YouTube next time. Back pain due to nerve compression, L5 compression, rubbing hard, 38. Yeah, whenever there is a back pain, I have always told you, whenever there is a back pain and it is because of compression. See what happens in back pain if there is there is a compression. There is either because of that compression is there, herniation is there, slip disc is there, the disc has come out and it is pressing the nerves. So normally most of the patient would have better by compression, by rubbing and all. But there are few remedies which are very, very important. You can write down in your materia medica. First is bryonia, argentum nitricum, ledum pallor, and kali nitricum. Male 30 years nervous patient, please suggest tissue salts and remedies for fibromyalgia and fibrosalt. Symptoms are joint pain, ligaments and stiffness, pain walking. Now, whenever tissue salts come, your mathematics and scope of understanding a patient and using a remedy is only related to 12 tissues. Why do you limit yourself to 12 tissues? There are some other remedies also which could give you good results. But as you have asked me, I'll tell you something about 12 tissues. In these cases, I have found when there's fibromyalgia, calcarea floor 6x, ferrum phos 6x, and silicea 12x have given good result depending on the symptoms. You can always use that. But I'll go one step further. Whatever the remedies I have told you, if you do give that remedies in LM potency, LM potency, you will get much results, because in LM potency, you can repeat, and these cases would require repetitions. Remedies for ligament tear. See, whenever if you have a case of ligament tear, few remedies, write down in your remedy. If you don't understand anything, these remedies are very, very important. Belly spur, very, very important. Ruta graveolens, very, very important. Belly spur, ruta. Third is calcarea floor, it would be there. And fourth, rustox, it would be there. These 4 remedies will give you maximum results in your practice. And there are other remedies also, but these 4 remedies, very good results. And do take a history and then give a consultation remedy. But these 4 remedies in repetition, if you have LM potency, will give you very good results. Yeah, ruta is there. Tumor on the right bed discharging bloody serum. The nipple is very swollen, and also tumor exists to the upper jaw. Painless tumors is in a dog. Okay. So now, whenever you get cases, especially I don't know, in animals I have never prescribed, but whatever symptoms I know in my practice, I'll tell you. There are 3 things in nipples I have seen in these type of cases. Either there is discharge of blood, and if the patient is classically telling you it's your dog, so blood. 3 remedies, very, very important in my practice. You can always try those remedies. The first is phytoleca, the second is lycopodium, and the third is sulfur. Very, very important remedies. These 3, lycopodium, phytoleca, sulfur, first line remedies. Also think about 2 remedies which I found very useful in my practice: hemimyllis and carcinosin. And if the patient is only discharging blood, normal blood, the bloody water, it's classical blood, thick blood, then 2 remedies I have found very, very useful in my practice. First is kali cyanide and second is silicea. So we have differentiated into 3 parts. First, bloody water type, that is lycopodium, phytoleca, sulfur. Then second, blood, exactly blood. Then it is kali cyanide and silicea. And third, just discharge from the nipple, sometimes bloody, sometimes equarius, sometimes serious. Then there are a lot of remedies. So these 3-4 remedies you can use in your practice. I hope the dog improves, and if he improves, do share your case. In the next YouTube. I think this was a marathon of questions. Very nice. You can still, there's no question on Instagram today, or I have missed those questions. I may have missed some questions on Instagram. You can always write, because we are live both on Instagram also and YouTube also. Patients, those who have hypertensive to sulfur in any potency, which remedy can be thought of? Hypersensitive to sulfur, in homeopathy, I have never seen a patient react with sulfur. If you have a patient very hypersensitive to sulfur and you feel that the sulfur is the constant remedy, then give sulfur in LM potency. Simple as that. Okay, I knew that phytoloca and silicea have been tried, but try then kali cyanide. Kali cyanide is a very, very interesting remedy. Kali cyanide, kali cyanatum, cyanatum. It's an interesting remedy, and it has given me good results in few cases. In kali cyanide, 2 things are very important. I have seen kali cyanide also important for cancer of tongue. When there's neuralgic pain in the region of tongue, and there is a sudden sinking sensation, that is kali cyanide. So that is actually kali cyanide is potassium cyanide. If you can try that remedy also, it would be fine, and then if it will be good results. In relation to dog, whatever I have seen in my practice, I normally ask the activity of dog. how is the activity changed, or what is doing abnormal from what he was doing before. The activity, the sleep part and the eating part, I normally ask in case if a dog comes to me for treatment. So do ask that also in your practice. Chilly and not thirsty at all. Kali cyanide, Cilicia would be a good choice in understanding these cases. And see the activity also. Activity also would be important, because in these type of cases, I've seen the activity of dog. Normally, then we change the remedy, whatever I have seen in my practice. Some basically symptom which does not have that bloody discharge. That's why I didn't share the remedies. But do think about 3-4 remedies more. Phosphorus, again an important remedy. Second, again you have to use this remedy if nothing works for thalaspi. Thalaspi is a remedy then discharge for nipple. And one remedy which is very very rare, and you should think about that remedy if it's not working, that is Ziza. Ziza aurea, Ziza. Can we phimosis? I just answered Dr. Goel. So you again watch that YouTube. I just answered that question of one of the doctors. So you can all go to the YouTube live and you get the answers. I will be nothing is but full of energy. So you can try this remedy where phosphorus is a very interesting remedy for you. Ziza and thalaspi. You can try these remedies. Dr. Prajapati. Okay, nice. Thank you. So yeah, it's already half an hour, and I think we come to the end of the session. Nice interacting and nice question answer. I also enjoyed it. I also had to use my brain very fast in order to give you the answers. So nice talking to you. Until next time, thank you and goodbye.